low flow devices, which consist of two things: nasal cannulas and face masks. Also to make note of is that there are three face masks, guys, and we're going to go over them individually. Now, nasal cannulas. Here is a nasal cannula and the stats behind it. So when using a nasal cannula, it's going to be important to remember that it ranges from 1 to 6 liters of oxygen and that it is placed in the external nares. Now, it's also the most commonly used oxygen device due to things such as mobility and comfort for the patient. Another key fact is that the maximum amount of oxygen COPD patients can receive by means of nasal cannula is 1 to 2 liters, okay, for those COPD patients. Remember, they breathe due to the lack of oxygen, so we're going to provide little by little. We don't want to give them too much. Now, here are our face masks, and there are three to discuss. First is the simple face mask, then partial non-rebreather, and then a full non-rebreather face mask. So simple face masks, these are simple. They provide 5 to 10 liters of oxygen and are used for short-term oxygenation therapy. Also, they are very handy when transporting patients. So we're transporting a patient from the unit to maybe go to CAT scan or X-ray or to a different unit, and we want to maintain their oxygenation. We can slap on a simple face mask, transport them through the hallway, and that will benefit them very well. Moving on, we get to partial non-rebreather face masks, and they provide 8 to 10 liters of oxygen and are also used for short-term use. An important fact about these masks are that they have exhalation ports in them, which is going to allow the passing of exhaled gases out of the mask. You can see it right there, exhalation ports. That's going to allow for the passing of exhaled gases out of the mask, such as carbon dioxide. Now, for partial non-rebreather masks, there's also a reservoir bag that is attached to it, and oxygen is to be maintained to keep the reservoir bag half to 1/3 filled. Lastly, we get to our non-rebreather face mask. It's the last resort when it comes to the face masks. Now, there are one-way valves on this mask, which is going to prevent any exhaled air from entering the bag, which furthermore provides a constant oxygen supply to the patient. Also, a non-rebreather mask provides a minimum of 10 liters of oxygen, which is going to help maintain the inflation of the bag attached to the mask.